Good afternoon. Bon après-midi.
Good afternoon.
So before I start today, I just want to talk about some feedback that I'm receiving about the messages that we're giving recently around people staying at home and trying to flatten the curve. I do hear of people still gathering in large numbers and going out and about when they really should be staying at home and heeding these messages. We are trying to protect the public. We're trying to protect our resources. We're trying to protect our healthcare workers. We want New Brunswickers to stay safe, and we want them to stay at home. So as all of New Brunswickers are aware now, the spread of COVID-19 coronavirus is a serious health threat. It is a global pandemic which is being fought on many fronts, but the most important one is in each of our homes, where we have the opportunity to slow the spread of the virus, reduce the illness, and save lives. New Brunswick is not immune to the spread of the virus. As of today, we have 11 confirmed and presumptive cases, which includes 3 new cases identified in the last 24 hours. The 3 new cases are a female between 60 and 70 years of age in Zone 1, which is the southeastern part of the province, who had been on a cruise. A male between 60 and 70 years of age in Zone 3, which is the central part of the region, the province, who had been in contact with an individual who had direct contact with a traveler, and a female between 50 and 60 years of age in Zone 3 who had traveled to the United Kingdom.
New Brunswick is not immune to the spread of the virus. As of today, we have 11 confirmed and presumptive cases, which includes 3 new cases identified in the last 24 hours. A female between 60 and 70 years of age in Zone 1, Southeast, who had been on a cruise. A male between 60 and 70 years of age in Zone 3, Central Zone, who had been in contact with an individual who had direct contact with a traveler. And a female between 50 and 60 years of age in Zone 3, Central Zone, who had traveled to the United Kingdom.
It is imperative that we each practice social distancing for the sake of ourselves, our friends, families, and neighbors. And also for people we may not know directly, people who are vulnerable to the virus, as well as our healthcare professionals who are striving every day to slow the pace of this disease. Today I want to speak about the role we can all play in flattening the curve. And there are 2 images behind me, one in French and one in English, just showing the graphic of that, whereby you see the dotted line represents our healthcare capacity. The higher peak represents people not following the measures that we have in place right now. And if you see the lower curve, you see that if we're all following these practices and playing our role and taking this very seriously, our responsibility, our civic duty, we can flatten the curve and take the pressure off our healthcare system and our healthcare providers and decrease the number of cases and deaths that we will see in this province. It is up to us to take actions that will slow the spread of the virus and give our doctors, nurses, and other healthcare professionals the best chance to cope with its impact. Ce virus se transmet par des contacts étroits.
The virus is spread through close contact. The more we get in touch with others and closer the contact, then there is higher risk of spread.
Close contact. The more people and the closer the contact, the greater the chance that the virus will spread. If we reduce our contact, the immediate spread of the virus is hampered, as the virus can and will spread quickly if given the opportunity. Our aim is to slow this down so that the number of cases is spread over a longer period. This won't be resolved quickly, and all of our actions must be geared to reducing the spread of illness. We have asked that New Brunswickers stay at home, and I offer my thanks to the thousands who are doing that. But this is not the time for house parties. Stay home. Restez à la maison.
Stay home. It's not the time to organize play dates. Stay home.
Hang out with their friends. Restez à la maison. Ce n'est pas le
Stay home. It's not the moment to keep bingo halls open. These type of things can contribute to the spread of the virus.
Responsibility for our actions. Please stay home with your families and limit your contact with others. When you must be in contact with others outside your home, try to stay at least 2 meters apart from other people, or 6 feet. Make sure you wash your hands frequently with hot soapy water, or if you have access to alcohol sanitizer, you can use that as well. But the research shows that the hot soapy water actually works the best, and there are many, many YouTube videos on how to do that safely and effectively. Coughing and sneezing into your elbow, disposing of your tissues when you blow your nose. What's happening right now in Canada, in the world, in New Brunswick is unprecedented in history. I was speaking with the Premier before I came in, and in 1918 there was the Spanish flu that went around the world globally. And at that time, New Brunswick had about 350,000 residents. And in 1918, 1 in 4 New Brunswickers died. And that was actually a better case than happened elsewhere. And the types of measures that we're instituting right now actually were instituted in 1918, and it was actually at the advent of the beginning of public health and the Department of Health here in New Brunswick. So, 100 years ago, we were living something like this. None of us were alive back then. So this is unprecedented in our lifetime, and it is very serious, and we all have to work together. We've never been through something like this before. Je félicite chaque...
I would like to congratulate every citizen in New Brunswick who takes action to help us face this challenge. If you are worried and anxious, do not forget that you are not alone.
And we must all do our best to manage the stress we are feeling. And there are concrete things that you can do to look after yourself, to care for yourself and your family. Make sure you eat healthy. Make sure you get some balanced meals, get regular exercise, and get proper sleep. You can meditate, practice hobbies, and do things to help you relax. Vous pouvez discuter avec les autres.
You can discuss this with others and explain what you feel in a way that protects your health and that of your community.
Informed, but we all have our limits. Know when to say when. Avoid information overload, especially on social media. And when you need help, there are resources available to you. Right now, your mental health is just as important as your physical health. And I'm going to say it again because it is really important. Your mental health is just as important as your physical health. This virus has the potential to overwhelm our healthcare system, our society, and every one of us. Cependant, il est possible d'éviter.
However, it's possible to avoid this catastrophe. We can slow the spread and flatten the curve. We all have the power to contribute to this war effort. The time has come for us all to exercise that power. Thank you very much.